first, I would like to ask for your permission to use this video for educational purpose and on internet.
Yes.
Okay. Now, tell me about your experience with the spine surgery.
My first surgery was a fusion, and they went through my abdomen and my back.
We call that ALIF, anterior lumbar interbody fusion, but then as well they turned you around and went from the back as well.
Yes, correct.
When was that?
That was back in 1989.
1989. Do you remember that surgery?
I do. It was very painful and took a long time to recover from that.
No, first of all, how long did you stay in the hospital after that surgery?
It was 7 to 10 days.
7 to 10 days. And do you remember how long the surgery itself was?
I think it was 5-6 hours long.
5-6 hours. That is nothing unusual for an ALIF procedure where we open you from belly, put the guts and the organs to the side, mostly up, and then fix the bad disc, and then we turn you over and take the bone off and put screws in and so on. So how was the recovery from that surgery?
It took a long time to recover, and about a year after I had it done, I started having a lot of pain again down my leg, and they had to take me back to surgery and remove the screws from that. That was not as bad because they...
Yeah, they just took the screws out,
Correct.
Now, I want to turn around and show what they did. They took the bottom disc out and put a spacer in. Bone is growing. They took lots of bone away here in the back. We call it laminectomy. And, that bone is there for a reason. And when we take it off, as well as by us literally massacring the muscle in the spine, we are creating some instability. And you see they took the bone even a while, mostly as well in the L4. And now the L4-5 is failing you. It's falling forward. You have spondylolisthesis and severe disc disease. So practically, we surgeon, by doing this kind of devastating invasive surgery, we program the next surgery for you. And as a matter of fact, you told me that the surgeon then told you this is not going to be your last surgery. What did he tell you?
He said that once you have a fusion, your back would be weaker.
Yeah, and you understand why, because we remove lots of bone and we literally turn the muscle into scar, into dead tissue.
He said that I would be good for about 10 years and then he would see me again.
Yeah. Now, I think that is, at least for 1998, was practically normal, but you just recently were offered exactly the same surgery that you were offered 20 years ago or 22 years ago. You were offered the same surgery again, is that right?
Yes, and my first surgery was in 89.
89, okay.
So, even longer.
So 30 years ago.
Last fall, I was offered the same surgery to have.
And to be fair, 30 years ago, that was a good surgery. That was the best we could do. But I think we have a problem if after 30 years, you're still offered exactly the same surgery with the same standard that was 30 years ago. So what were you told about the new surgery? What you need and how they would do the surgery?
They said that they would remove part of my vertebrae. They actually showed me, or I could go online and see a video of how it was to be done. And so they would remove part of my vertebrae again, and that part would stay out. They're not putting it back. And that I would hate him for 6 months after.
For 6 months. So
6 months.
You would hate him for 6 months. Did he tell you why you would hate him for 6 months?
Because of all the pain and
because
recovery.
Your recoveries would be at least 6 months before you could do basic daily activities.
Correct.
Okay, well, and then how long would the surgery would be? Did he tell you about the details of the surgery more?
No, he pretty much said go online and look at the video. And so I went online and looked at the video, and I didn't like what I seen.
Yeah, and you came to us.
Yes, correct.
What were you expecting differently from us?
I was hoping to have a laparoscopic procedure so that I didn't get cut.
Yeah, we called it minimally invasive or keyhole surgery. Laparoscopic would be if we would enter your belly, which we don't actually, and that's one of the advantage of our surgery. We don't enter your belly. to do the surgery. We do it all through the posterior tissue with the very small tubes. And for us to do this surgery, our track record is constantly under 1 hour. 90% of our patients for this kind of surgery go home within 24 hours, and the recovery to be back to basic daily activity is actually weeks. And some of our patients go back even to the more demanding jobs within weeks. Obviously, you have to be still careful, but this is practically changed the entire way of we are doing this kind of surgery. Now, you already have been offered surgery, but when you came to us, we still put you through conservative management. We didn't just schedule you for the surgery. Is that right?
Correct.
Yeah, so we put you, even though you have been practically offered surgery, we put you through our conservative management, and now, unfortunately, it seems that they are not going to be able to help you. So we are going to do the surgery for you, but this is going to be an average about 40-minute procedure with the 1 night hospital stay. Within 2 to 4 weeks, vast majority of our patients go back to their previous life, and we can show it consistently that this is what we can offer statistically. Now, having said that, I think it is have no objection to open old-fashioned surgery in certain situations, but I think one of the problem is if our standards is 30 years later still the same. If you are offered after 30 years still the same surgery, I think for most of our patients actually today we could do better. And I think have you had a chance to go and read about Inspired Spine, who we are and what we do?
I have seen you before.
Okay.
That's where I
Mm-hmm.
seen that I should make an appointment here.
Yeah, yeah.
So I have seen a lot of information on that.
Okay. Well, what question or comment, or do you have anything, any other question or comment?
No.
With that? Okay, thank you so much for the interview.